Hello friends, today I will discuss with you all about strabismus. Let's start. Strabismus, it is the deviation of the eyeball towards inward, outward, upward, downward in any direction. As a result, the visual axis of the two eyes are misaligned so that the visual axis of the one eye is focused on the fovea but other eye get out of focus. That is strabismus. Causes of strabismus. Strabismus can be caused by misalignment of the extraocular muscle. Suppose an extraocular muscle of an eye is paralyzed or overactivated, then the eyeball will deviate and it will produce strabismus. Cataract. If the person is having cataract, that means opacification of the lens, then the light cannot pass through the lens properly. As a result, the eye will deviate for proper focusing and it will produce strabismus. Thyroid problem. If the person is having thyroid problem, that means hyperthyroidism, then it will cause exophthalmos in the eye, that means proptosis. As a result, the eyes will bulge outward and it will produce strabismus. Heredity. If the person is having heredity problem of strabismus, then he can lead to strabismus. Down syndrome. If the person is having Down syndrome, then it can lead to strabismus. Now classification of strabismus. Strabismus can be classified as follows. Strabismus is three types: pseudostrabismus, latent squint or heterophoria, manifest squint or heterotropia. Pseudostrabismus. Pseudostrabismus is when the two eyes seem to be strabismic, but actually they are normal. Their appearance look like strabismic eye. Pseudostrabismus is two types: pseudoesotropia, pseudoexotropia. Pseudoesotropia, if the person is having a prominent epicanthal fold, a negative angle kappa, a too small interpupillary distance, or an excessively broad nasal bridge, if this condition arises, then it will make the eyes look like a strabismic eye. But actually, these eyes have normal binocular vision. Pseudoexotropia. If the person is having hypertelorism, that means a condition of wide separation of the two eyes, or a positive angle kappa, or an excessively narrow nasal bridge, or too large interpupillary distance, or narrowing of the lateral canthus, this condition make the eye look like strabismic eye, but these eyes have normal binocular vision. Now look at this picture. The girl apparently seemed to have a squint, but actually she have normal bifoveal vision. She is pseudo-strabismic person. Now latent squint. If the strabismus present in the eye in a very small angle, then a tendency of the eye to deviate is overcome by the fusion reflex during binocular vision, that is latent squint. So latent squint is six types: esophoria, exophoria, right hyperphoria, left hyperphoria, encyclophoria, excyclophoria. Now manifest squint. If the angle of deviation of the eye is very large, then our eye cannot overcome fusion reflex and squint is seen. That is manifest squint. Manifest squint is five types depending upon the concomitance of deviation, depending upon the direction of deviation, depending upon the constancy of deviation, depending upon the fixation behavior, and depending upon the time of onset. So depending upon the concomitance of deviation, there is comitant strabismus. In this type of squint, the angle of deviation remain constant in all gaze, that is comitant deviation. Now in comitant squint, in this type of deviation, the angle of deviation is different in different gazes, that is concomitant squint. Now depending upon the direction of deviation, that is esotropia, that means it denotes inward deviation of the globe. Exotropia, it means outward deviation of the globe. Right hypertropia, the right eye is elevated relative to the left eye, and left hypertropia, the left eye is elevated relative to right eye. In cyclotropia, the deviated eye is intorted along the anteroposterior axis, that is in cyclotropia, and excyclotropia, the deviated eye is extorted along the anteroposterior axis, that is excyclotropia. Now look at this picture. Here the person is having esotropia in his left eye. The eye is deviate inward to the nasal side, that is esotropia. Now look at this girl. She is having exotropia in her right eye. Her right eye deviate outward, that is exotropia. Now hypertropia, look at this guy. His right eye deviate upward, that is hypertropia. Look at this woman. Her right eye deviate downward, that is hypotropia. Now encyclotropia. Here his right eye deviate towards inside along the anteroposterior meridian, that is encyclotropia. And excyclotropia, here look at this girl's right eye. Her right eye is deviate outward along the anteroposterior axis, that is excyclotropia. Now depending upon the constancy of deviation, so constant squint, when the deviation remain constant in all direction, that is constant squint. And intermittent squint, when the deviation may present sometime or absent other time, that means off and on, that is intermittent squint. And periodic squint, a squint may always be present for a particular distance of fixation and absent for others, that is periodic squint. Now depending upon the fixation behavior, unilateral squint, if squint is present in one eye, that is unilateral. Alternate squint, if squint is present in two eye alternately, that means one eye is normal, other eye is deviating. After some time that eye, the deviate eye is normal, then other eye is deviate alternately, that means alternate squint is there. Bilateral squint, in it both eyes are squinting simultaneously, that means squint is present in both eye in the same time, that is bilateral squint. Now depending upon the time of onset, so it is congenital squint and acquired squint. Congenital squint, if squint is present before 6 months of age, that is congenital squint. And acquired squint, a deviation which develop after 6 months of life, that is acquired squint or acquired strabismus. Now let us discuss about its treatment. So first of all, prismotherapy is there. So suppose a person is having exotropia in his right eye. So in prismotherapy, I will place a base in prism in front of his right eye, so that his deviated right eye will be in its normal position and eyeball can align properly with the other eye, that is prismotherapy. If I place the specific or accurate power prism in front of that eye, that is prismotherapy. So if the person is having exotropia, then apex of the prism face outward, that means base in prism. Esotropia, apex of the prism face inward, that means base out prism. Hypertropia, apex of the prism face upward, that means base down prism. And hypotropia, apex of the prism face downward, that means base up prism. So this is prismotherapy. Look at this picture. The boy is having esotropia in his left eye, but after doing prismotherapy, his eyes are aligned properly. That is prismotherapy. Now BOTOX therapy. Botulinum toxin is injected into the extraocular muscle, and it paralyzes the extraocular muscle so that the eyeball can rotate properly and aligned with the other eye for normal binocular vision. That is BOTOX therapy. Look at this picture. Here BOTOX injection is given into the extraocular muscle to paralyze that muscle. Surgical treatment. So surgical treatment, surgical procedure, resection of muscle to align the two eyes, that is surgical treatment. So surgical treatment is the ultimate treatment which is done to align the two eyes so that normal binocular vision can achieve. So that's all friends. Thanks for watching, and please don't forget to like my video and subscribe to my channel. Thank you so much.